Hello everyone. In today's edition, I will tell you about the early signs of liver problems that can help prevent dangerous consequences. The liver is the largest internal organ in the human body, performing vital functions such as detoxifying foreign substances, removing excess hormones, storing energy reserves and vitamins, as well as participating in blood formation and much more. Therefore, problems arising from liver diseases affect the entire body. In general, the characteristic feature of liver diseases is that the organ lacks pain receptors and ailments progress without significant pain syndrome. A person feels pain only when the liver has significantly increased in size. Therefore, it is important to pay attention to the manifestation of any alarming symptoms. A healthy liver is the foundation of a healthy life, so it is extremely important to timely identify the primary symptoms of diseases and liver problems and start treatment immediately. These are signs of liver problems. Before we move on to them, I would like to ask you to subscribe to the channel. Most liver pathologies progress without visible manifestations, and the problem can only be detected through laboratory tests. If there is a predisposition to problems with this organ or other factors that provoke their development, it is recommended to undergo periodic examinations. In the development of liver diseases, it is important to detect symptoms early. Even the slightest deviations should not be ignored. To do this, it is necessary to know what signs may indicate liver problems. Itching and peeling skin. Liver cells actively produce bile, which directly participates in processes occurring in the digestive system. After processing in the liver, bile is directed to the gallbladder through special channels. In case of the slightest disturbances in liver functionality, bile begins to accumulate and ceases to flow, leading to its stagnation. Subsequently, these factors provoke itching and skin peeling. Sometimes painful sensations are observed. This type of problem indicates an overloaded liver or accumulation of a large amount of bile acids in the organ tissues. Itching in liver problems can be localized on the soles of the feet, palms, and other parts of the body. When this symptom is present, it can be noted that it intensifies closer to the night and with body warming, for example, after taking a hot shower. Among other typical skin manifestations, pinpoint hemorrhagic eruptions, multiple bruises, cholesterol deposits in the form of yellow plaques on the palms, elbows, and feet can be observed. In cases of prolonged liver diseases, characteristic changes in the palms are observed. Palmar erythema may occur symmetrically. This is redness of the skin in the area of the elevation of the thumb and little finger. When pressed, the skin becomes pale, then returns to its original color. Cracks on the heels. The liver must constantly produce bile, which helps the body absorb these fatty acids as well as vitamins E, C, A, and B3. These vitamins are necessary to maintain the skin's tone. In case the liver is functioning poorly or improperly, bile is produced in insufficient quantities, and as a result the body does not receive the necessary substances. For this reason the skin becomes dry. If the problem is not addressed promptly, it can lead to complications. Therefore, it is necessary at the very least to adjust the diet and maintain proper hydration. It's better to enrich the diet with greens, vegetables, fruits, berries, and whole grain porridge. Swelling. Liver problems can lead to issues with the kidneys and blood vessels. Dysfunction in this system leads to water retention and accumulation of salts in the subcutaneous tissue. This manifests as the appearance of pinpoint edema, mainly in the legs. Hair loss. Hair loss is often observed in liver diseases. The liver processes almost all the nutrients that enter the body. If liver function is impaired, then the supply of building materials to the body for growing tissues also suffers. Therefore, wounds heal more slowly and hair may fall out faster. Increased sweating. If the concentration of harmful compounds in liver cells is high, the organ begins to work in overdrive. As a result, symptoms of excessive sweating appear and body temperature rises. Sleep problems. With a high concentration of harmful substances in the body, the production of the hormone cortisol, which controls sleep, intensifies. This affects the process of falling asleep. Persistent sleep problems can be harmful to health. One should be alert if increased drowsiness, difficulty concentrating, feelings of apathy, and depressed mood are observed. These are the first signs of liver problems. Flavor. High temperature is typically a marker of active inflammation in the liver, gallbladder, or ducts. Febrile fever accompanies conditions such as acute cholecystitis, cholangitis, hepatitis, active cirrhosis, and liver abscess. Jaundice. Parenchymal jaundice is caused by liver cell damage and usually develops gradually over a long period. Thus, the patient himself does not notice its appearance. First of all, the sclera and soft palate become yellow. The underside of the tongue, later the palms, soles of the feet, and then the entire skin turn yellow. The color of the skin with hepatic jaundice is saffron yellow or orange. Mechanical jaundice is the result of blockage of the common bile duct by a stone or tumor. It occurs suddenly and develops very quickly. The skin color ranges from greenish yellow to dark olive. Obstructive jaundice is accompanied by intense itching of the skin. Abdominal distension. Almost all diffuse liver diseases are accompanied by an increase in its size. With portal hypertension, the spleen also enlarges simultaneously with the liver. In emaciated patients, pronounced asymmetry of the abdomen is observed, with noticeable bulging of the enlarged liver. Flatulence. The cause of flatulence becomes difficulty in digestion. With portal hypertension, there is an accumulation of fluid in the abdominal cavity. Its volume can reach several liters. The abdomen with ascites looks distended, with the navel protruding. Spider veins appear due to worsening of the condition of blood vessels. Red spots on the body. With serious liver problems, red or brown spots begin to appear on the body. Such a rash can extend down to the soles of the feet. The spots appear due to deterioration of blood vessels and disruption of blood circulation, particularly in the lower parts of the legs. The primary signs of circulatory problems manifest first. Dyspepsia. Liver diseases can manifest dyspeptic symptoms such as belching, nausea, vomiting, diarrhea, constipation, feeling of heaviness after meals, bloating due to increased flatulence. Due to impaired digestion and fat absorption, there are qualitative changes in stool. This is the end of the video. On the channel you can find a lot of interesting videos about the benefits and harms of fruits and vegetables, as well as diseases and ways to treat them. So please do not forget to subscribe to the channel, click on the bell. I will be grateful if you put a like and share the video with your family and friends.